Okay, this is Dr. Mark Carriage taping a video this time from the group series I've designed. Obviously, it's called uh, co-facilitation. There's a lot of dynamics when you do co-facilitation, and today we're going to talk about it a bit. So I could be reached at mcarich@aol.com. If you want a copy of the uh, PowerPoint, I'm assuming that we're seeing the PowerPoint. I haven't got that creative enough to figure out the difference if it's showing or not. But at any rate, if you want a copy, just shoot me an email. I will not answer the phone. Okay, a little bit about me. Let's see. Okay, again, I'm Dr. Mark Carriage. I've done a video set on hypnotic intervention, and this is wrapping up the group series. And I'm going to be doing a therapy, and I might be doing a sexual aggression series as well, or a couple of pieces. Um, but at any rate, I've been around for at least 45 years. I got my bachelor's in '79 at SIU Edwardsville, master's in '81 at St. Louis University, in 1985 St. Louis University, and a counseling psychology internship at Texas Tech University '84 to '85, which was one of the best experiences I ever had. My supervisor was Dr. Ralph Gordon Hammer, and he was the best I've ever had. And Dr. Cindy Willis did actually operate the internship piece of that counseling center. Okay, so, and she got it accredited. And I've been working in the prison system in Illinois for the last 40 years in various capacities. I am currently working in private practice with Chad Welch at Metro East Counseling in the Metro East of St. Louis, Missouri. We're on the Illinois side. Excuse me. Um, I'm also consulting at Transitional Center Incorporated. Matt Adams was kind enough to get me started in this. He actually suggested it. At first, I thought, yeah, right. But I've been doing it. He's not present. He works out of the office. So, introduction to this module. I like cold therapy. I think it could be extremely powerful and useful, especially if you're on the same page. So, there are a few elements to look at, which we will. We're going to start with basic rules. So, basic rules are based on teamwork and team effort. It's a team. So if your boss comes into the group room and wants to play group therapy with you, you're on equal terms. Therefore, both therapists are equal partners. Power and control of the group is equally distributed amongst both therapists. Um, both therapists have to be on the same page or have compatible theoretical approaches so you don't clash. Minimize conflict. Do not victimize each other. And these are things I've seen. All these things I've seen happen. Uh, one, you don't want to victimize each other. Two, you don't want to allow clients to victimize each other in the group. It's easy to do. And you want to be supportive of each other and the group as well. You want to also avoid inappropriately enabling each other. And in other words, don't overprotect each other. It's hard to do sometimes in a group. Depends on what you're dealing with. Again, I spent 40 years dealing with a lot of sexual aggression issues, and That's a whole nother can of worms that I will tackle at some point in time. All right, so if you do have a conflict with your co-therapist, try to avoid major conflicts. Work them outside of the group. Minor stuff work inside of the group. Um, as it shows, resolution can be agreement or agree to disagree. Respect each other. Avoid power conflicts and power plays, and absolutely do not victimize each other in the group. Resolution. So it could go one side or the other. You may agree to disagree and move on. I like male female teams. Why? I think it's ideal and state of the art, especially in sexual aggression field. But I think in really probably a lot of various sub areas of mental health and therapy stuff. Um, so clients, I need to take that word offender out. I don't use that anymore. But anyway, clients experience how males and females can get along, harmony. They can experience females as authority working equal partners. One time I had a female therapist come into my group at Menard Psych, early 1990 ish, and to do some stuff on substance abuse. Apparently, she came over, or they experienced her as a female in authority. And from my predecessor in the years before, the culture of the group was to really put females down. And I know get that's crazy. I don't want to go any more into that story. But so what the group um, expected me to put her down because afterwards um, they complained about her and they expected me to put her down in a group. I said, well, she's your new co-therapist, so you have to be equal partners. Of course, that blew their mind, and we turned the culture of the program and group around. Also shatters any myths and stupidities involving female and male relationships. It actually comes across as cross gendering parenting. And again, I can't emphasize it enough. It illustrates for this population, males and females are equals. Yes, even in this current cultural pop, males and females are equals. Okay, some plans and tactics for co facilitation. I think outline, talk about what you're going to do before you go into the group. What's obviously keep your eye on the ball. What's the goals of the group? That's the ball. Uh, always suggest taking a few minutes and processing the group after the group. Don't wait a week after because you're going to forget and stuff could come back up. Always process the group after the group. Know each other's strengths, weaknesses, vulnerabilities, key issues, etc. Um, plan how to handle problems. Maintain flexibility and not rigidity. You got to be flexible. You got to adapt to things that are going on. You got to be pliable. Balance the styles and the roles, support versus confrontation. And when I say confrontation these days, I mean challenging clients. Um, questions to pose when you do co-facilitation. And this comes from Corey. Corey is one of the premier people in the group world still. He's still alive. He's probably in his 80s. I venture to guess. He's got his wife involved, and plus his daughter has got a PsyD, I believe. But at any rate, they're all involved in the Corey group production. He's also produced books on psychotherapy and such. So I mean, done his stint in the therapy field. At any rate, here's what he said: questions to pose as a co-facilitation team. What degree is there trusting in the relationship between you guys? Do you respect each other? What's the differences? Are they complementary? Or are they going to be symmetric and oppose each other? Um, how does problems in functioning as a therapy team, is it complementary or symmetrical? Did the two of you make plans and prep going into it? Do you feel organized enough? Have some kind of game plan involved and interested in the group? 3, are you making time to meet between group sessions on a regular basis to be on the same page? Then, if you are, how productive are your meetings? Do you focus exclusively on your group and the group members? Or are you willing to talk to each other about reactions, abreactions, and stuff that occurs in the group to members and to each other? And if I didn't mention at the beginning, this is a professional video snippet for professionals in the field of mental health. At any rate, does your theoretical orientations, are they compatible? That's number 4. And hopefully they do affect the group goals and procedures positively. Do you and your co-leader agree on the division of responsibility? Like, what are you guys doing? Taking notes? Who's taking what notes? Blah, blah, blah. And are you sharing leadership responsibility to each other's satisfaction? Number 6, you guys, well, one is your expectations uh, realistic, unrealistic, and for the group. And what are your expectations of how the group's going to perform, function, and the outcomes for members? How are the members reacting to each of your leadership styles, you guys together, etc.? Is one having particular difficulty with any particular group member? Number 8, do both of you feel free to initiate suggestions and techniques in the group, or does it have to go one way and exclude the other person? Does either of you feel like you have to hold back, hoping that the other will do most of the leading, or can't get a word in edgewise? Either all that's a problem if it's occurring. Number 9, are you both paying attention to how you open and close group sessions? 10, does each of you think of ways to evaluate the progress of members? Because you might have a whole different ideas than your co-facilitator as a whole. I mean, do you have some systematic feedback for members about how they respond to your leadership? Number 11, which is extremely important, can't emphasize that enough. Are you in agreement with the co-leader about self-disclosure? What are you going to self-disclose? And I wouldn't go about self-disclosing somebody else, your co-leader's history or anything, unless it's planned out very carefully and for a particular response, therapeutic response. So don't go blabbing about your co-leader's history and all that stuff. You leave that out of the picture unless it's extremely detailed and planned and comfortable. Both parties have to be comfortable. And then how do you handle disagreements and problems between the two of you? Are you competitive? Does one have to win over the other? Or can you openly talk about the members and your relationship and how it's going? Number 12, you want to balance the challenging and support in the group. If you keep confronting one particular group member, both of you, unless it's again a planned intervention, um, it could not work well because It's good to have support when you're doing the challenging. And then are both of you equally appropriately supportive and confrontive? 13, do your two styles of leadership blend or do they collide or, you know, that kind of stuff? 14, do you spend time talking about how it is for each other to lead with the other? Are you able to tell your co leader what you like and do not like about working as a team? That's a difficult one. Number 14 is very difficult to do, but it pays off. 15, are the two of you reviewing each session, paying attention to any changes and wherever the group's going? And of course, you're going to make mistakes, but can you capitalize on them? There's something I like to do is debrief. I like to do debriefings. And so here's how debriefing can go. You want to look at the trust level, look at the respect levels, look at the reaction of members to each other and to you guys to each other, expectations of self and others. Feel free to interject at any time instead of, oh, I can't say anything because they'll get mad. Um, you can't have that attitude. Do one or the other feel like they have to hold back? If they hold back, if the other is going on a direction, or can they hold back? If somebody's going on a direction just to see where it's going. Does your team meet regularly to discuss these issues? And if so, are they productive? And if not, why not? On all fronts. Do you feel free to initiate suggestions and directions, or do you have to hold up? Do you handle problems between the two of you on various issues outside a group? And if you do in group, obviously, hopefully, there's a resolution or you agree to disagree. And can you talk openly about your relationship with each other? Professional, of course. Um, you really don't want to get into a sexual relationship with your co-therapist because that really adds an additional factor, and your group members will pick up on it. Okay, so do you, and again, feel free enough to express likes and dislikes about the team, blah, blah, blah. Can you comfortably disagree or not? And how do you, again, overall, how do you handle conflicts? Group process and management issues is important. Do you prep for the group? Do you make plans individually or together? Like, this is what we could do today, blah, blah, blah. Do you feel supported by each other? Do you review and debrief each session? These are all management issues. Do you learn from your mistakes? Oh, that didn't work, so we can try this to get the desired therapeutic result. And theoretical and therapeutic orientations, do they mesh? What is yours? What is your partner's or your co-therapists? What therapeutic orientations? Are they compatible? Do they collide? Can they be complementary or not? Are you comfortable with those types of interventions? And how do you all deal with conflicts in this area? Group dynamics, if you don't hang together, you're going to have a mess. And believe me, I've been there and done that. You work in the field for 45 years, doing groups for 41 years or 40 years or whatever it is. Um, you will uh, dabble in these dynamics, dabble in these issues, and have excellent experiences, positive experiences, and not so good experiences. Um, so, group dynamics. How do you handle each other? How do you handle issues, problems, dynamics as they emerge in group? What leadership styles are they compatible? Are you compatible with? Do you evaluate the progress of the group and the progress of members in the group? You both support and challenge with group members? And how do you open and close groups? How do you deal with group members' reactions in group, especially if intense? So, conclusion, this is an important video session because at least it opens your eyes up to co-therapy, which I think is extremely important. I like co-therapy for individual and group and family and marriage and couple or whatever else you want to bring into the therapeutic context. But you have to be on the same page. You have to respect each other. It helps to work together. It helps to be cooperative with each other and work out the conflicts. It'd be nice if it was all complementary. And heavy conflicts resolve outside a group. Lighter ones you can resolve inside.